Good evening, everyone. Welcome to today's edition of Limi Hospital Instagram Live, a program where we'll x-ray some of health conditions that are very important to our viewers. We'll take our time to discuss it among our various audience. Limi Hospital is one of the hospitals that's located at the heart of Abuja, where we take care of our guests. So this program is very important. I encourage everybody to tune in, go live, invite your friends because it's going to be awesome. Today we'll be looking at living with asthma. Living with asthma. I'm sure that all of us know what asthma is. But before we go on, let me introduce the people that will be, my boss that will be handling this topic, who is.
I'm Dr. Jonathan Idoko, family physician, Central Area, Limi Hospital.
I am Dr. Michael Omoke, personal physician in Limi Hospital. So straight to business. Log in, charge your batteries, call your friends, tell them that this is an opportunity to learn one or two things. You cannot just miss it. And even if you eventually miss it, it's also recorded. You can always go to our page and either YouTube channel or Instagram page to still view it. I promise you that you'll not regret being part of this program. So right now, we'll be going to introduction. So we all know asthma, but what is asthma? Let me ask my chief, what is asthma? What asthma is?
Well, asthma is a disease that affects the respiratory system. That is the system that we use to breathe. Okay, the system that we use to breathe, the respiratory system consists of the windpipe. That is initially is called the largest one is called the trachea, which divides into two to form the bronchus. So the passage or the windpipe is where asthma really affects.
Okay. So it's very clear that asthma affects, there are many systems in the body, digestive, reproductive, and the rest of them, up to 9 systems, but asthma affects respiratory system. And respiratory system is a system that is in charge of breathing.
Yes.
So that's to say that asthma has to do with breathing difficulties.
Breathing apparatus.
Okay. So what happens when you have asthma? What happens?
Okay, well, asthma is more or less an allergic reaction to certain things called allergens or triggers. Okay, and what happens is that once that person is exposed to the trigger or the allergen, the the windpipe or the respiratory tract begins to respond like an allergic, it causes an allergic reaction that causes the windpipe to swell, one, reducing the passage, narrowing the passage where air passes. The other thing is that there is a secretion of very thick saliva or mucus that further narrows or reduces the space where air can enter the lungs through. So what you find in asthmatic attacks is that the person begins to struggle to take in air and bring it out. It tries to bring, he uses all the muscles of his chest, okay? And you can see him actually struggling to breathe. That is what asthma is all about.
Okay, so it's very, very clear with us that the cardinal symptom that happens in asthma is air hunger. Air hunger, because there is blockage of the tube that is used to deliver this thing. Good. So let's go ahead for symptoms of asthma. What are the symptoms? What do you see in someone that has asthma?
Well, for someone that is having an asthmatic attack, like I just explained, the person is actually struggling to breathe because of the narrowing of the passage where air goes through. The person tries with all, force the air into his chest, where the exchange of gases takes place. He forces it in, he tries to force it out again. So there is a struggle, okay, and you can see the person actually sweating. It's very obvious that the person is finding it difficult to breathe.
Okay, so struggle to breathe. I think there's also a wheeze.
Yeah, that is when you listen to the person breathing. There is a wheeze.
You hear a
you
wheeze.
can hear a wheeze. The sound of the air struggling to enter into his chest and come out.
Okay, so wheezing sound is like a symptom of asthma. What of the signs? As a doctor now, what will you find out when you listen to the chest of someone that have asthma that will make you think that this is most likely asthma?
Well, of course, you can actually see the person trying to breathe, struggling to breathe. That's one. And then the other thing you need to do is to listen to the entrance of the air he's breathing. It produces a particular sound that is only found in asthma. Okay, and that is what we use to make the diagnosis of asthma. Apart from that, if the first time the person presents with that kind of presentation symptoms, you may not be able to say whether this person actually has asthma or not, except it happens again
Okay.
a second time and the picture is almost similar or the same. Then you can begin to think that okay, maybe this person has asthma.
Okay, that's interesting. So, what's the name of that sound that is heard?
Well, it's they call it inspiratory and expiratory bronchi.
Bronchi.
That is medical terms
Medical
for
term,
trying to
yes.
diagnose asthma using
Yes.
our
So,
knowledge.
so,
Yeah.
so when you come and we think you have asthma or listen to your chest, we hear that particular sound that is called bronchi. Once we hear it, we say most likely this person has asthma. So, as can asthma, who can have asthma? Who can have asthma?
Well, asthma is, like we said, is a respiratory disease, and it can happen to those who are especially allergic to what we call triggers or allergens. It's not to everybody. There are some people that can walk through dusty situations or smoky environments and they don't have anything. But for asthmatics, once they go through that and they breathe in those air, that dust or the smoke, or even when there is a pulling in the air, especially for certain seasons like dry season, they begin to have the attack.
Okay.
Yeah.
Okay. But what I was trying to bring out is that it can occur, it can happen to anybody,
It can happen to anybody
any
who's
age.
at any age whose body is sensitive to those things that we mentioned called allergens or triggers.
Okay. So, once someone have asthma, what are the tests that can be done? Are there tests that can be done that will help us uh, diagnose asthma? Asthma.
Well, like we said, the first thing that points to asthma is actually one, the presentation, the difficulty in breathing. And you see, they usually put their hands on the table, trying to assist the chest in breathing, taking in breath and bringing it out. That's one. Number two, when they come in, we listen to the chest to see whether this sounds like expiratory or respiratory bronchi. When we hear that, it further buttresses the fact that maybe this person has asthma. Then going further, there is a test we call spirometry, which can also help us to pinpoint that this person most likely has asthma. Then for such patients, of course, we like to do a chest x-ray in case, apart from the asthma, there is another superimposed infection of the chest.
Okay.
Yeah.
That's fantastic. So this is what we'll do. Once you come, we'll run through all these things to be sure. So because there are other airway diseases that can present with asthma.
Like
A
asthma
lot of
or
them,
with
like chronic
asthma, yes.
obstructive pulmonary disease, they will just present similar like asthma. But what's unique about asthma? Someone that has asthma and then they give, what will happen that will make us
Well,
differentiate that this is asthma and not that other chronic pulmonary airway diseases?
for asthma, first we have established the fact that they are caused, the attack is caused is as a result of them being exposed to triggers or allergens. Now, if we make or we are suspecting someone has a asthmatic attack, if we give them what we call an airway a inhaler, for
Salbutamol.
example, an inhaler that helps to quieten all the reactions that are causing the asthma, and they respond positively to it, then we can say this person has asthma. And one of those is Ventolin inhaler.
Okay. So what it means is a classical sign of asthma that it can be reversed.
Yes.
Those tightening
Using
using those bronchodilators. Once you
yes.
use it, it can, and the person will be fine.
Yeah.
In fact, once the person is out of the attack, you'll be wondering, is it this same
Well,
person that was doing as
yeah,
if he
you're
wants to
wondering
die?
whether this
Yes.
actually happened or not.
Okay, Chief, please, is asthma genetic? Is there any genetic component of asthma?
Well, what we can say is that asthma can be hereditary. Okay, there is a genetic component, but it's more of a hereditary thing. Sometimes it can skip a generation and meet the next one, but we know that if there is usually a family history, background family history of asthma in the previous generation before you see it in the next one.
Okay, very, very important that it can be hereditary and it can skip some generation.
Yeah.
So it might just be your grandparents that you did not meet that had asthma, not your father.
Yes.
And you'll be saying, my parents don't have asthma. Why is it happening to me? It can skip a generation. It can be your auntie, it can be your uncle, but it's usually family history. Once again, this is Limi Hospital Instagram Live coming to you from Limi Cardio Care Hospital. And today we are looking at living with asthma. We've enumerated that asthma is a disease of the respiratory system, just in case you are just joining us. And there are a lot of things that can trigger asthma. And one very, very important symptom of asthma is wheezing sound and difficulty in breathing. And when we listen to with a stethoscope, we hear a particular sound that is called rhonchi. And one thing that will make asthma stand out is that by the introduction of drugs that are called bronchodilators, it reverses. So some other disease of the respiratory tract might not reverse, but if it's asthma, it's going to respond
dilators very quickly.
Okay, that's very nice. So this asthma now, what are these allergens? What are these triggers? Because it's possible that you may have it and you will not know.
Yeah.
So let us give examples of triggers, things that can trigger this asthma. So let me allow my chief to say.
Well, I've mentioned some before. I said there are some triggers like, of course, trigger for each person. It may be a single trigger. It may be dust, maybe a particular perfume. It might be pollens from flowers. Okay, it might be cold, for example. But for other people, they may have multiple triggers. So it's difficult to say, okay, if you expose me to this, I will have an attack. For some people, it's single. For such people, it's easy for them to, if they can avoid the triggers, okay, they are fine. But anytime they're exposed to it, they will come down with an attack. So the triggers, like I mentioned, are 1, smoke; 2, dust; 3, mite. Mites can come from maybe the beddings, it can come from rugs in the room, it can even come from moldy environments.
Mold, okay.
Then, of course, you have pollen from flowers, especially this is actually seasonal. So, for those seasons, people with asthma usually find it difficult to come out of the house. Okay, then, of course, I mentioned smoke and perfumes also. And of course, the temperature of the room, for example, if it's actually very cold, it might result in triggers of an asthma. We also know that sometimes emotional upheavals can also trigger asthmatic attacks.
Yes, there's a component that there's a link between anxiety and asthma.
Yes.
There's a link between depression and asthma. So there's an emotional component. It's not just physical. And what is very important is that it is individualized. So people, what is my trigger for asthma? My asthma might not be the same thing that is trigger for you. So the game changer for everyone is to try to identify his or her individual trigger.
Definitely.
Any day you find out your trigger, you've sorted out 70% of your issue.
Your attacks,
because
yes.
once you are able to avoid these triggers, I know people that have lived 10 years, 20 years without asthmatic attack. Why? Because they were able to identify their triggers and they
able to avoid it
the most, especially if it's triggers that can be avoidable.
That you can avoid, that you identify, you know that this thing I can do without it, of course.
Okay.
Yeah.
So very, very important, Chief. Can asthma be cured?
Well, that's a very big question. You see, a lot of people try to find out whether asthma is curable. Asthma is not curable, I'm sorry to say, but it can only be managed.
Okay.
It can only be managed with medication. Okay. I think, of course, I don't think certain foods can also trigger.
Yes, there are certain foods, certain drink, just find out just before you started having an attack what happened.
What happened? Just dial yourself back a few steps and see before this attack happened, what changed? What changed in my environment? In front of me, behind me, in the room I am in? What changed that resulted in me being in this state at this time? You may be able to finger what caused your attack, and if you can recognize it, you are halfway through helping yourself.
Okay, so it's been established. Our viewers should know that asthma is not curable. So anybody that will give you any drug and tell you that once you take it, your asthma will go, that person does not like you. So asthma is amongst the classical medical illness that can only be controlled. And some of them include diabetes, hypertension, sickle cell, epilepsy, and asthma. So these 5 illnesses, all you need to do is to take your drug, control it, and you live your normal life. Life expectancy can even rise up to 80 in people that have asthma. So what are the drugs? What are the drugs that can be used when an asthmatic attack? What do you do when there's an asthmatic attack?
Okay. Well, first of all, before I go into that, you were saying that five illnesses that can only be controlled. This is asthma is not an illness that you say, okay, God forbid it's not my portion. That is
Yeah.
already there. It's not something you pray about. Of course, there's nothing wrong with praying about it, but it needs a specific type of treatment, and that is why we're where we are now. Now, the drugs that you can use, they are classified into two. There are drugs that you can use for the acute phase of the attack, okay, and they are the ones that you can use to prevent the attack for as long as possible. So an example of the one you can use for acute state of the attack is called Ventolin inhaler. Okay, we'll show you how to use your inhaler in a short while. But Ventolin inhaler is supposed to be used when you feel uncomfortable, you feel an attack coming on, you just use your inhaler and it calms everything down. Okay. Then the second class of drugs, they are called, they study the lining of the tubes that air passes through. They are actually steroids, okay, that are used directly against the lining where the reactions take place. So an example of that is Symbicort or Serotype.
Serotype, okay.
Yeah. So the difference between the two of them is that one is for an acute attack. As soon as the attack is about to start or is ongoing, you use the inhaler. If you use it properly, it's going to stem or stop the attack from continuing. Then the second one is not for the acute attack. You're supposed to be using it every day. You take a puff every day, whether you have an attack or not, just continue taking it. What happens with that is that the attacks are few and far between when you use the preventive one.
Okay, so it's very important now. There are two forms of inhaler: the one for acute attack, the one for prevention. So if you're able to use the preventive one very well, you can stay long without
using the attack one.
Okay. So is it possible that you want to use an inhaler maybe for the acute attack and it fails? Is it possible?
It is very possible for so many reasons. One, it's possible that inhaler is empty. Number two, it's possible that inhaler is expired.
Yeah.
Number three, it is possible that you're using inhaler in the wrong way.
Okay.
So those are the reasons, among others, that may cause a failed treatment using the inhaler.
Okay.
Or you're actually using the wrong inhaler, for example.
Okay, fine. So when it fails like that, what's the next option?
Well, for an acute attack, that you have actually used the right inhaler, that's the Ventolin inhaler, and you are sure it has not expired and it's not empty, the canister is not empty, you can come to the hospital. For example, you come to Limi Hospital, either central area, or you come to Cardiac Care Hospital, Limi Hospital, for example. There are things we have, we call them nebulizers, that we can use where the Ventolin inhaler fails.
Okay. Yeah. So when Ventolin fails, you come to the hospital. In fact, as you are using your Ventolin, you start planning for the hospital, because it's possible that there are other coexisting diseases in the chest
that you will not know about.
So that is making it very, very difficult for us to control it.
To work the way we are used to.
So for people that have continuous asthma, we advise them to have their own nebulizers. Yes. I know some of my patients that they have their own nebulizer, they know how to use it. There are even some of them that does not need a light source. There is an attachable battery that you just attach and it will clear your chest. And once it clears your chest, you are fine. But it's also important to see a doctor so that we look at other things, because it might not be occurring in isolation. There are other things that can occur together with asthma. So once again, this is Limi Hospital Instagram Live, coming to you from Limi Cardiac Care Specialist Hospital. Limi Hospital is a 3-in-1 hospital that is located at the heart of Abuja, and we offer world-class services to our patients. In fact, we call our patients guests. We treat them as a guest in 5-star hotel. And once you come, you can never regret coming. So today we are still looking at living with asthma. Asthma. All of us, we know asthma. We've been able to establish that asthma is a disease of the airway, that asthma has triggers, and the game changer for your asthma is identifying your triggers and avoiding them. We've also established that asthma is not curable. That is about control, treatable. And once you have an attack, there is an inhaler that is for acute attack, which is the Ventolin inhaler. There is one for prevention of attack that you keep using. But whenever the acute attack fails you, it's an indication to come to the hospital where we'll be able to nebulize you, do chest x-ray, check other things that can superimpose on asthma.
Can make the treatment of asthma
very difficult. Okay. So what are other illnesses in the respiratory tract that can mimic asthma, that can look like asthma?
Of course, you have things like bronchitis. You could also have pneumonia. We call it lower respiratory tract infection, but actually you can have pneumonia. They can also be superimposed. You can have asthma and then
superimposed respiratory tract infection. Well, yes. And response is higher, is worse in that case.
Worse, is difficult to manage. You cannot manage this at home. You have to be in the hospital for it to be properly managed, because for us to be able to tell there are superimposed illnesses, we have to do certain tests that will tell us, okay, this is not asthma alone, there is something else, apart from the asthma that is happening to this guest.
What are those tests? Can we just enumerate one or two of those set tests that we can do?
Well, I think I've mentioned one. We'll do a chest x-ray to see how the lungs are behaving. We'll also do a full blood count to tell us if there is actually a bacterial infection superimposed on the asthma.
Okay.
Yes.
Chief, can asthma kill?
Well, asthma that is neglected, asthma that is not properly taken care of, asthma that is happening repeatedly without any rest in between can result in death.
So what's the name of that situation when you continue to have continuous attack without space in between, or multiple attacks?
Yeah, we call that status asthmaticus.
Okay, so the name is status asthmaticus.
It's actually a very severe type of asthma that cannot be managed anywhere else but in
the hospital,
where you have ICU facilities, which we actually have in a cardiac care multi-specialty hospital.
Okay, so it's very important that asthma can kill. It's not something to neglect. If you have asthma, you're supposed to take all these cautions that we are telling you, because that's what will make you not to have multiple attacks. Identify your allergies, identify your triggers, and work on them. If it's things that you can control yourself, control it. If there are things that you cannot control, there are some of them that you cannot control, you still try the much you can to control it. Does smoking, cigarette, and alcohol have any effect on asthma?
Well, of course. The lungs are trying to manage themselves, and then you are superimposing it with smoke. Of course, you are making the whole thing worse by smoking. So if you are trying to prevent asthmatic attacks, you must let go of smoking. Alcohol too has its own role to play in asthmatic attacks.
Okay. Yeah. So smoking, if you are smoking, try and stop. Apart from asthma, there is no illness that smoking doesn't have a negative effect on. In fact, in medical school, they usually ask us what's the cause of cancer. And they say, if you don't know any cause of cancer, just say smoking. And once you're able to say smoking, it will affect a cancer in one way or the other. So if you are smoking, you can come out of it. Just set a target for yourself. It doesn't have any health benefit. So just try and stop. If you are drinking, try and stop. Does exercise have any effect on asthma?
Exercise actually helps asthmatics.
Okay. But I think it should be mild or moderate exercise.
Well, we are told that asthmatics can exercise.
Exercise, okay.
They can exercise, yes. Mm-hmm. But of course, you must have your inhaler or something in case
anything happens.
Can trigger an attack, yes.
So your inhaler, once you're asthmatic, your inhaler should be with you anywhere you are going. And the fact that you've not had an attack for a very long time doesn't mean that you can't have an attack. So that inhaler can save your life. And from time to time, you look at your inhaler, check whether something is still remaining there, check whether it has expired.
Yeah.
Do you understand?
Very, very important. Because
yes,
you could have an inhaler, you kept in your bag for the
Yes,
past 6 months and it has
it has
expired.
expired.
Because you've not had an attack for a while, you leave it there. Then the day the attack happens, that's the inhaler you are going to pick.
Yeah.
You pick it, it will not work. At that time, it is actually an emergency. You need to find your way to the hospital. Or you are going out and because you're in a hurry, you pick the wrong inhaler, for example, and then you have an attack. It's not going to work. When you check and you realize that this is not the right inhaler for me at this time, find your way to the nearest hospital and then get the proper help you need.
Okay, so it's very important. What Chief say is very important. The proper use of inhaler to be sure it has not expired. They will go a long way to help us. Good evening once again. Welcome to Limi Hospital Instagram Live, coming to you from Cardiac Care Specialist Hospital in Abuja. And today we'll be looking at living with asthma. And my Chief, Dr. Jonathan Idoko, and I have been looking at this topic. We've been able to establish that asthma is a disease of the respiratory tract. There are a lot of things that trigger asthma. There are symptoms that you get when you have asthma. There are also signs, different signs you get when there is asthma. And very, very important, that asthma is not curable. It's about managing. Manage it, avoid your triggers, and you live your normal life. We've also been able to tell you the different forms of inhaler. There's one for acute attack and one for prevention. So this is very important. And I'm assuring you that if you use your inhaler very well, avoid triggers, you can stay longer than
You can live your
normal life,
You can
can
live
get
your
to
normal
100
life.
years, and it's not your fault that you're
Naturally.
asthmatic. It's not your fault. There's a genetic component to it. It's not your fault. If you look very closely and ask questions, there must be somebody, either your grandparents, either your auntie, either many of them you might not even know
You
them.
might not know
You
them,
might
but
not know them.
you just discover that you're asthmatic because one of the questions we ask when you come to the hospital is that is there a family history?
History. Yeah.
Is there anybody in your family that has been said to have asthma?
So it's very
That is
possible.
that is one thing that also help us in coming up with the proper diagnosis of it.
Okay, so this is still Instagram Live. You can send your questions to the chat box. We'll
We'll try to answer your
answer it
questions
the
for
much
you.
we can. If you have any questions so far from what we've discussed, any gray area, anywhere that is not clear to you, send your questions, your comments to the
The
boss,
chat box and
and we'll always
get to
answer.
them for you.
Okay. Can someone be born with asthma?
Yes, like we said, it is hereditary. So a person can be born with it. Less than 2 years is difficult to diagnose asthma.
Okay.
But like I said before, when you have the same type of attack more than once, and the response to ventolin inhaler or bronchodilators, as we call them generally, is positive, then we can say the person has asthma. But as at the time of birth, it is
It will be very
difficult to
difficult.
make that diagnosis. Yes.
Okay. Okay. Does it does it become worse with age?
Well, age does not affect it. In fact, what we know is that sometimes when asthma starts at an early age, the person can outgrow it. Sometimes people outgrow asthmatic attacks. When it starts at the later part of life, the person might live with it for continuously.
Okay.
Yes,
Okay. So there are chances that you may
you may
outgrow your
outgrow
this thing,
asthmatic. Yes,
but that's not the reason why you now have your inhaler
you
and
have an
avoid the
inhaler
triggers.
because you might think it's gone, and then one day it might
One day.
surprise you when you are
Okay.
not prepared.
Okay. So we are still on Instagram Live, Limi Hospital Instagram Live, coming to you from Cardiac Care Specialist Hospital, and we are looking at asthma. Asthma. One of the respiratory tract infection that can
Respiratory
actually
tract diseases
that can actually cause death.
cause difficulty in breathing, can affect your lifestyle. Okay, it can also be financially draining.
Okay.
So you have to do the right thing at the right time, get diagnosed properly, take your drugs as prescribed by your doctor, and then you can continue to live your life normally.
Is it important for an asthmatic patient to still visit his or her doctor even when there is no attack?
Yes, we want to in visiting your doctor or the hospital. we want to know how frequent you have your attacks, okay? Because that helps us to treat you better. Because our aim, we cannot cure asthma, but we can reduce the frequency of attacks. So if it's becoming too frequent, that is affecting your job, is affecting your lifestyle,
Or
affecting
sleep.
everything about you, you cannot sleep properly without having an attack, you need help. We need to look at you again and see if there are any comorbid diseases, other things that are superimposed on the asthma that we can take care of to further reduce the frequency of the attacks you're having.
Okay, so it's very important. Don't just relax and say, why am I going to the hospital since I don't have attack? There are so many things you can do in the hospital. There are so many tests that you can do that will just save your life. The
Yes.
only hope for cure of most illnesses is early diagnosis. But it's a pity that in this climate that when people are sick, they try various options.
Before
They go to chemists, they will call their auntie. Her
until
auntie will say
they
her own
call
solution.
village,
Call
ask for,
village. Is when it is now critical that they
they
remember to come to
remember
the
the
hospital.
hospital and then they
So you
come and
need
they
to
tell you.
have a good health seeking behavior. And Living Hospital can offer you that. We offer wellness check where you can do a lot of tests, check all your organs. Don't go and stand on those machines that you stand on and they'll tell you
And
that
then they are making
they'll
diagnosis, they've seen,
tell you
tested
plenty
this, test that.
things, tell you to pay the highest amount of money. They'll put fear inside you, and once they say you can even borrow to pay. So us, we do evidence based. If something is wrong with your blood, we'll check your blood. If it's wrong with any part of your body, we'll check it.
Check it.
And that will also actually help you so that you go away from all these illnesses. So asthmatic attack can actually be taken care of. So let's talk about prevention of attack. What are the preventive measures?
Well, the first and foremost is the first of all, if you're able to detect your triggers and you're able to avoid them. Of course, there are people with single triggers, there are people with multiple triggers. For single triggers, it's just for you to identify it. Once you identify the trigger, you avoid those areas or those triggers, as it were. Your attacks will be few and far between. But for people with multiple triggers, it's actually very difficult because you don't know what causes the attack. If there are multiple, it's difficult to avoid. That's
Okay.
one. Then number two, um,
Don't
if
hear
you
you.
are a smoker,
Stop.
stop smoking. Okay. Number three, we usually say that people who have asthma, it is actually better for them not to use rugs in the house.
Okay.
Okay, because rugs they absorb dust, and when you sweep or you dust the house, the dust comes up and then it begins to cause is a trigger. So of course, the person might come down with an attack. The other thing again is that for beddings in the house, you will advise that you change your bed sheets as frequently as possible, maybe once in 3 days or something. Some people have their bed sheets, they leave it for 1 week before they change it or they wash it. So, but for people who have asthma, you cannot do that. You change it every 48 to 72 hours. That means you have to wash frequently. And then the house has to be, there has to be cross ventilation most of the time. Okay, an asthmatic cannot stay very long in a stuffy environment. So you must avoid such places. Even overcrowding can cause
Can
that. Some
cause.
people in a big crowd, maybe in a church or a mosque, for example, because of the stuffiness of the environment, might come down with an attack.
Okay.
Yeah, then of course, exercise. Exercise helps to reduce the frequency of attacks.
Okay.
Yeah.
Losing weight. Does it have anything? Might
Ah,
not be a direct link with
I'm
it.
not very sure about that.
Okay, fine,
Yes.
fine. So we are still expecting your questions in our boss. Anything you want us to answer for you concerning this living with asthma, bring it up. We are ready to answer you. We've been talking about living with asthma for the past 30 to 35 minutes,
Yes.
and we've been able to establish that asthma is a disease of the respiratory tract. And I want to ask Chief, this asthma, is it a chronic illness?
Well, if you listen, if you join, if you are just joining us, previously we said that asthma cannot be cured; it can only be managed. So any disease that is only managed
And
but
not
cannot be
cured.
cured is actually a chronic disease. It's going
So,
to be there for a long time.
So asthma is actually a chronic illness. It's actually a chronic illness. Okay, we are still expecting your questions from the junction boss so that we'll answer them. So how does inflammation of the airway affect asthma, my asthma?
Well, for medical people, inflammation actually has four components. Four or five now. I think I can remember four. The first one is that there is swelling. Two, there is a pain. Three, for
Redness.
asthma, for example, there is secretions. Okay. Um,
Redness.
the fourth one is redness. That is if you can see the
The
place.
person.
But in with respect to asthma now, there are two important things that we pick out from inflammation. One is swelling. The size of the tubes, of the airway, the tubes that carry air into the lungs, they are fixed, they are specific. They are lined inside with membranes, okay, very thin membranes that have special organs in them. These special organs, when they are exposed to certain triggers, those linings will begin to swell up.
Okay.
Once they swell, because it's a round thing and they swell, of course, it's going to
Narrow
narrow
the
the
space.
passage where air
Okay.
goes through. At the
Okay.
same time, the triggers also cause them to release liquids, liquids that can be very thick. Okay, so when you combine the swelling and the liquids, they tend to narrow the passage where air goes through, and that is where you get the wheeze from. And that is how we hear the ronkai.
Okay.
Yes.
Okay. Very, very nice one there. So we are still looking at living with asthma. If you are just joining us, you've missed some, but you can still go away with one or two things. But one, we've been able to dissect everything we need to know about asthma. And we've been able to tell you that asthma is a respiratory system disease.
Yes.
And the game changer for an asthma is actually identifying your triggers and preventing them. If you are able to identify your triggers and you prevent them, you can stay very long without an asthmatic attack. But that doesn't mean that it will not occur. So always have your inhaler anywhere you are going because that inhaler can save your life.
Yes, definitely so.
We're still expecting your questions from the junction, from the boss
From the question box,
question box. So if there's anyone, we'll go through it. If there's no one, we'll still continue. Once again, this is Limi Hospital. It's a 3-in-1 hospital located in the heart of Abuja.
okay.
Can weather changes trigger asthma?
Yeah. Well, of course, in our own part of the world, we have two types of weather, two types of climate. We have the dry season and the rainy season. For the rainy season, what it brings is cold. For cold, for some asthmatics, that can trigger attacks. For the dry season, for example, there is more dust, okay, and at that time, that's when some flowers throw their pollens in the air with a lot of wind, of course. People can inhale this, and for asthmatics, it's actually not a very good time. So they have more attacks at this time.
Okay, that's very nice. We are rounding up. We are still waiting for your question. We've answered that. We are still waiting for your questions. Ask us, we are ready to answer you. And I also want to tell you that this Instagram live is being recorded. You can always go and watch in case you didn't start with us from the beginning. You can go to our YouTube channels, can go to our YouTube channels, you can go to our Instagram page and go and watch it. And I assure you that once you watch it, you will learn a lot. So can infections, so we've talked about it a little, but
We
let's just
actually
see,
talked
ask it
about
again.
it. Yeah. Well, infections can cause asthmatic attacks. How? Because infections cause inflammation. When you have an inflammatory response, especially in the windpipes, of course, you can have an attack.
Okay. Okay. So we are still looking at asthma, asthma, asthma. Why is it sometimes so hard to know what triggers an asthmatic attack?
Like we said before, there are some people whose triggers are just
Multiple. Okay.
a single. For those ones, once you can avoid the triggers, you are good to go. But for people with multiple attacks, wherever they go, there is one or two or three of the triggers that cause the attack. So for such people, it's actually very difficult to manage. Okay, so those people they will probably will use their ventilator inhaler more frequently. They may need to replace it more frequently. They may have to visit the hospital more frequently because their triggers are multiple.
Okay, thank you, Chief.
Mm.
Why does someone's asthma get worse when the person is upset, or when the person is angry or depressed? Why?
Well, the why is something we do not know, but we know that emotional upheavals, okay, anger, uh, depression
Depression.
can actually trigger an attack or make it worse, but we don't know why.
Okay, that's interesting. So, for those just joining us now, this is Limi Hospital Instagram Live, a program where we look at very important health topics that will benefit the community at large, even people outside the country, because there are diseases everywhere. And one thing about diseases is that if you're able to know what it is and you know what to do, the disease will not harm you. So, this is a very important topic, living with asthma. And we've been able to establish that you can actually live with asthma, and that it's not your fault that you're asthmatic, and that asthma is not curable.
You know, they said knowledge is power.
Yeah.
Okay, if you know about your illness and you know what to do part time, of course, you are helping yourself a great deal. So, if you know about asthma and you have anyone that has asthma that is having asthma attacks from this
Discussion.
discussion that we're having, you are increasing your knowledge about asthma, and most likely you are going to be able to help the person.
So it may not be for yourself, it might be your friend. Maybe your friend you are living with, anytime you go, you might not even know that he or she has asthma. But with the knowledge, with all the signs and symptoms and how they present, it might just be what the person has. And this time to pick up that phone and call the person to come to a hospital, a good hospital, where the exact diagnosis will be made and will now figure out how the person can live with asthma.
You know, the thing about Limi Hospital is that they don't just treat you, they educate you about your illness. They tell you the things to do even when they are not there. They help you to understand your illness, and when you understand your illness, you're able to manage it better.
And talking on that, we don't just only treat, we also encourage positive lifestyles that will also help you to be healthy. For instance, every last Saturday of the month, we engage on a health walk where everybody all over Abuja come to have fun. The fun is something else. We do free hepatitis B screening. We do check blood pressure, check people's sugar, teach cardiopulmonary resuscitation, which is what to do when someone have heart attack. Many people have been dying because of carelessness. But if you're able to know these simple things, it's going to help you. And very interesting, the August edition is coming up tomorrow in Central area. The time is 7 a.m. Don't miss it. Invite your friend that is so big that you want to help to come down to have normal BMI. This opportunity. You will learn a lot, you will interact with friends, and you will never regret coming for that health talk. So tomorrow by 7 a.m. and every last Saturday of every month. In fact, we've done up to like 15 or 16 times, and it's always on point.
It's always very interesting.
Very interesting.
You
So
see, everything, like every illness that is not curable, for example, hypertension, diabetes, the illness, the treatment, there is no treatment that we give that does not include exercise. The beauty of the health walk tomorrow is that one, you come, you exercise yourself, you make your heart happy. Number two, of course, we're going to screen you. We check your blood pressure. We check your hepatitis status. We also give free hepatitis vaccines.
vaccine, that's if you are
Okay.
negative.
Yeah, if you are negative, we give hepatitis vaccine. If you are positive, God forbid, we also give you advice on how
What
to
to
go
do.
about it, what to do about it, so that you can live long and achieve all your life goals. Apart from that, also, there are instances where you are standing in a queue somewhere and somebody just drops and nobody knows what
What
to
to
do.
do.
What happens is that people start speaking in tongues, they collect water and pour on the person and all that. But there is something very simple that you can do to save that person's life, and that is what we call cardiopulmonary resuscitation.
Station.
This is what one of the things we do
In a-
in our health work on Saturday tomorrow. We're going to teach you what to do when you find yourself in that kind of situation. It might be your sister, it might be a friend, it might be someone you don't even know at all. That thing that you do for 15, 20 minutes might save that person's life and you don't know. You might even be the person that will need it. Call your friends, let them come, let your neighbors come with you so that they can come and join in this work. We also have an ambulance that will take you, well, that goes with us. So
If there's
anyone that
any
is
issue,
getting tired en route at the routes we are going to take, you can just sit in the ambulance and still enjoy the ride and be with us. We also do aerobics. We
Yeah.
start the day with the aerobics
And end with
we end
aerobics.
with aerobics. Tomorrow is going to pack with fun, so you can't afford to miss it. Don't let somebody tell you the story. Come and be a part of it.
Cardiopulmonary resuscitation, we cannot overemphasize it. In fact, if you are someone that follows football, that's what saved the life of a player. One Manchester United player that is Ericsson, he was playing ball and he fell. What that saved him was that the keeper in the pitch knew how to do CPR and he started it immediately. As I'm talking to you, the guy is fine. He's even playing now.
Yes.
But if they didn't start that CPR, that would have just been the end of his life. Sam Okoraji, I'm very sure that's what killed him.
Yeah, but
Nobody knew what to
knew
do.
CPR then, so
So we
he
teach
just
it.
lost.
We teach CPR. You gain a lot. Please come tomorrow. So, Chief, I want to ask, at what point do you introduce aminophylline?
Well, aminophylline used to be the drug of choice in those days, but now because of
Side
the
effects?
side effects and the very low safety margin,
Okay.
it's no more used. So we prefer to use Ventolin inhaler. We also use our nebulizers. There are drugs that we use in nebulizer to help the
airway
airways
to open up.
to open up, to dilate, so that air can go in freely and come out freely. And of course, the things we use, we said nebulizer and inhaler. Those ones act directly on the airway, the parts where those pathologies, where those problems
Are
are.
happening. So it's straight to the lungs.
Yes, but if you use a
Amin-
Ventolin, it goes through the body, causing
Yes,
some
that's
damage
aminophylline.
before it even gets to where you want it to work.
Okay.
So we no more use aminophylline.
Yes, we can't remember the last time we used aminophylline.
Yes.
Once you're able to do all these things he said, there will be no need for aminophylline. If the asthmatic attack has not stopped, if it's asthmaticus, there are still other things.
There are
Just to
other
manage
things,
the
but-
airway, take the person to ICU, and before you know, once it's asthma, it will reverse.
It will reverse.
It
If
will
you use the
reverse
right
with
dose,
time.
but definitely not aminophylline.
Okay. So, good evening, viewers. I hope you are still with us. I hope you are learning one or two things.
Yes.
I hope your data is not a waste. I hope you'll be able to tell your friends about this topic.
We're
I
still waiting
hope,
for your questions.
yeah.
We're waiting for your questions so that we can help you out if you have
Out.
any challenges concerning asthma.
We also hope that you've learned one or two things about asthma that you can tell someone. I hope that you've learned that asthma cannot be cured. I hope you've learned that. I hope that you've learned that asthma can occur in anybody, young, old, small, big, that there is no segregation. We also hope that you've learned that asthma has a genetic predisposition. Sometimes there's usually positive family history. So it's very important. These are just the highlight of our discussion. We are waiting for your questions. As you bring them in, we'll also discuss.
Okay. I think what we didn't mention is the fact that it's not more common in men and women. It's both ways.
Both ways,
Both
okay.
male and female are affected. So you can't say because you're a woman you cannot have asthma.
And in Nigeria, we don't have data. We don't have good data to now say which one has more than.
Has a
But
higher-
anyone, male or female, can have asthma. Old or young can have asthma. And the game changer, I've been repeating it, is to identify your triggers,
Use
avoid
your laws
it.
correctly.
Once you're able to do that, you've sorted out 70%. You can stay so long without having asthma. Chief, let me tell you the first time I heard about asthma. It was when I entered JS1, so in a federal government college. So one of my classmates, I found out that his name was not among those that sweeps the class. That whenever he's exposed to dust, he'll just breathe it. Well, I didn't know what asthma was, but we were like somehow even the guy, this one no work for you and all these
Yeah.
things. But I now got to know that this is asthmatic attack, and that guy did everything to avoid all the triggers. He doesn't stay under the code. He doesn't sweep the class. He doesn't do anything. And I'm telling you, this guy is a doctor now, doing very well,
See?
doing very well, just
Yeah.
because he knew how to manage how to manage asthma. So, what is the difference between allergies and asthma?
Well, like we said, asthma is a disease of the airway, disease of the windpipe, pipe that carries air into the lungs. But allergens are more or less like triggers. Allergens are the same as triggers. Allergens cause the attack. Okay, they are triggers. So the difference is that asthma is a disease. Allergens are the ones that trigger the disease. Yeah.
So apart from those allergens that trigger the asthma, there are also allergies. Because I want to be sure what the person is saying. It might just be
Well,
allergy,
if it's allergies, then of course allergies happen in other parts of
other
the
part
body.
of the body, but
So if
for
an allergy happens in the windpipe, it's an
it's
asthmatic
asthma.
attack. Yes.
So you can have skin allergy, you can
Yeah.
have allergy anywhere, you understand? But if it's happening in the chest, in the bronchial, that means it's
The
asthma.
windpipe,
The
the pipes
windpipe
that carry
that
air.
carries air
Yeah,
is
asthma. Yeah.
asthma. Interesting. Hope you are learning one or two things from us this evening. We are rounding up already, forwarding your questions so that we can take all of them and recap.
Recap,
We
yes.
can take all of them and recap. While we are still waiting for questions, let's have a quick recap of what we've said today, Chief.
Yeah.
So what is the take home, take home, take home?
Well, the take home is that one, asthma is an allergic reaction of the windpipe. That's one. It's caused by exposure to the allergens or triggers. Okay, and it is not curable. It is controllable, it is
Not
manageable, but not
not
curable.
curable. Very
And
important.
okay, it's not curable, only controllable. And the take home that we want you to go home with is this: if you can identify your triggers. If you can identify your triggers, you are halfway down the line. Okay, you
Exactly.
avoid them, your attacks will be few and far between. And the treatment is bronchodilators. We have the ones for acute attacks, we have the ones for control. Okay, we've mentioned their names. Ventolin for acute. Control is steroids, either Symbicort, Serotide, Vecotide, whichever one that you are available. And of course, the way to use them, use Ventolin when you have an attack immediately. For the Symbicort or Serotide, you use it every day. One
For
puff
prevention.
every day. One puff every day. Continuously. Even when you finish that canister, you still get another one and continue to use because it prevents the attack.
There's a question from our question board that is asking if AC, staying under the AC can trigger asthma. What do you have to say about that?
But we've mentioned before that cold environments can trigger asthma, but more especially for ACs, if it is very dirty.
Yes.
If it is very dirty, it's not serviced on time, of course, it can cause more and more frequent attacks.
Okay. Staying under the AC cannot cause asthma. It can just trigger it,
It can
right?
trigger it, yes.
It can just trigger it. It will not cause asthma. Asthma is a genetic illness. Some people will not even know that they have asthma.
Yeah.
They will live for years until one day,
One day it just
one day it will
happens.
just happen. So So we are rounding up, we are rounding up, we are rounding up. Forward your questions. You can always go back to follow. Everything has been recorded. They are in our Instagram page. They are also in our YouTube channels and various other topics that relates to health. But we want our patients, our guests to be healthy. And it's not everything that is about drug. Every drug has its own side effect and adverse effect. So if you have other options to use, lifestyle that you can do so that you not take drugs, it's better to do that. And that's what we are educating you on, all the various illnesses and how you can prevent them.
Lifestyle we're mentioning, also remember our health walk tomorrow
Okay.
is a form of lifestyle,
Yes.
okay, that will help you live healthy. The health walk one, of course, we're going to educate you as well. We're going to give you some preventive vaccines, So tomorrow is loaded. We're expecting you. I'll be there. We're expecting to see you there as well.
I also want to advise my viewers to have a good health-seeking behavior. It's actually what will save your life. Many people have died carelessly. I know people that are hypertensive that they will not agree to take their drug and they'll end up dying, they'll end up having stroke. They'll say it's village people. No village people did anything. You are the one that caused your problem. So come, let's evaluate you. Don't always wait until you are down. Don't always wait until they will carry you to the hospital before you come. Do comprehensive check. Health is wealth. Any day your health fails, every other thing fails.
Yes.
Even that job you think you are the only person, they are replacing you immediately and life continues. So you have to take your health seriously. Don't go and start patronizing quacks around. Doctors are trained to evaluate you first before they will know the best drug to give to you. So have a wellness check or have three functional hospital you can come. And I bet you your life will not remain the same. More parting words from the chief. Parting words from the chief.
Well, like we said, asthma is controllable, is not curable. And of course, if you do the right thing, take the right advice, go to the hospital when there is need for it, you live a healthy lifestyle, and then you can do anything you want to do. All your goals, you can achieve them.
Okay, the difference between bronchodilators for acute and chronic diseases. This is our last question.
Okay, well, like we've explained before, bronchodilators are drugs that open up the airway that has become narrow because of allergic attacks, okay? Because of the narrowness, because of the allergens that have attacked those windpipes. So acute attack means that the person is actually having an asthmatic attack now, okay? And what you use bronchodilators. Chronic attack does not mean that the person is having the attack continuously, okay? The person has, for chronic attacks, what you use, like we said, you use drugs that will maintain
The airway.
the airway and reduce the frequency of attacks that you have.
Okay.
Yeah.
That's good. Thank you very much, Chief. I hope you've been able to learn one or two things today about asthma, about living with asthma. You can live with asthma. That's what we are trying to tell you. You can live with asthma. It's not your fault that you're asthmatic. It's a genetic predisposition. So identify your triggers. If you forget any other thing today, learn that the game changer for asthma is to identify your triggers and to avoid it. So we are closing. Always know that everything that we say today is recorded. You can always go back and get it. So once again, I want to thank my chief doctor, Jonathan, for
Thank you very much.
thank
Thank you.
you.
It
It
was
was
a
a nice
pleasure being
evening
here. Yeah.
of health education. I will see you next time. This is Dr. Michael Omoke, the anchor of this topic, signing off. Thank you so much. Have a wonderful week.